Hey guys, welcome back to our Emerge podcast. You're listening to episode 8, and my name is Cassie Dowden. I'm the marketing director for Emerge, and today I'm joined by our nurse practitioner, Amy Oden, and LPN, correct? Licensed practical nurse, Shauna. How do you say your last name?
Levinsky.
Oh, that's right. I was going to try to say it, but I didn't want to butcher it.
That's all right.
Today we're going to be talking about all things wellness. I think there's a lot of question about what, we know, everyone knows that we are a wellness facility, but what all does that entail? So first we're going to start with Amy, and we're just going to hear a little bit about her background, where she came from, her schooling, and I guess what brought her to Emerge and brought you to doing wellness services.
Absolutely. So I'm a certified nurse practitioner, family nurse practitioner, so I can actually see from birth, to elderly. My background was actually ICU nursing, and then that led to me becoming a nurse practitioner in the emergency room. Then I went on to working at urgent care. So I kind of like the thrill of emergencies, but I began to not be able to treat the actual patient. It was more kind of dictated by corporate and insurance as far as, you have to prescribe this and you can only spend this amount of time with the patient, and which kind of, it was a Band-Aid to not really fix the patient. So that really became a burnout for me.
Yes.
So then I started, there's got to be something else out there. And that's when I started researching into wellness, and found, there is ways to fix patients. There is ways to prevent high blood pressure and diabetes and things like that. So I then started, and that was about 5 years ago that I began into wellness. So luckily I had met Belinda actually at an Allergan training with Botox and filler. And so that's how I kind of got in touch with her, and then reached out to her, because you guys had Sarah before me, and she came probably, once, maybe a month?
Yeah, it was very seldom.
Yeah.
Very seldom, yeah.
I talked with Belinda and Taryn and was like, you guys could launch wellness and get that up off the ground and focus on, making people healthy.
And listen, it took off. And it was hard whenever we only had Sarah once every couple weeks or whatever.
Right.
We had everybody packed in to do insertions on those days. But every time someone would call and want to get in, we're like, well, you have to wait like 2 weeks or whatever. But it's so nice to be able to say, yeah, we've got an opening this Thursday or whatever. And your books are full.
We're full now.
I mean, you guys it's incredible how it just boomed. So, and I was going to say that's helpful that we've got this new space now and we've got a lot more room. And then we've added Shauna to our team. So Shauna, can you tell us a little bit about your background and then maybe how you came to Emerge and kind of found Amy? You guys are so good together. And so, yeah, what led you here?
So I've been an LPN for 20 years. I pretty much practiced in every setting. And then as I got a little bit older, I started, having the symptoms of getting older. And so I actually came to Amy as a patient.
Here at Emerge, you mean?
I
Wow,
did, yeah,
okay.
because I had gone to my primary doctor and, they were looking at using synthetic meds and, the road I didn't want to go down.
Absolutely.
So I
Antidepressants.
came and spoke to Amy, and she did a wellness panel, and I've been optimal, I would say, for 3 years now.
Wow.
And I've been working with her the last little over a year.
Yeah, you guys make such an incredible team, for sure. So if anytime you come to see us here at Emerge and you do schedule like either a new patient wellness consult or any of our other wellness services, which we're going to talk about here in a second, you'll either see, chances are you'll see both of them or at least one of them. So let's tell everybody, I guess, what all wellness services we do offer that we can kind of help people with, and maybe some of the most common symptoms that you guys see from some of the patients that come in.
So we, like I said, we can see all ages. We are actually seeing a lot of patients, children now, as far as hormone issues, teenagers with acne and stuff. So we can see a variety of patients' ages. But a patient often comes to us with brain fog, fatigue, low libido, joint pain, autoimmune diseases, depression, anxiety. I mean, the list can kind of go on. And they've usually, gone to their gynecologist. They've gone to their primary care and it's like, this is what I'm experiencing. They're like, and they get told that's part of aging.
And that their labs look normal.
And
Oh, wow.
yep. If they
and just live with it.
and live with
basically.
it, right. And oftentimes they won't even look at drawing their hormones, because they consider, it all to be considered normal. So patients kind of end up hitting a roadblock. Some of them go to self-medicating, some end up divorced, some end up in psych, you know, because they're starting with psych meds because that's what's going to control their anxiety.
Yep.
So we're usually their last resort when they come to us. And we sit down and we're like, okay, we have them fill out a symptom sheet, male or female, and past medical history. We look at the medications they're on. And then we're like, okay, we can fix this. So we look at drawing labs. We get lab results usually back within 24 hours. And we have them come back to another visit. And we sit down and say, from A to Z, this is what's kind of going on. You know, we look at all the thyroid panels where, you know, oftentimes at your primary care physician, if you think you have weight gain or you're feeling cold all the time, it's got to be your thyroid. Well, they'll look at a TSH is all they're going to draw and say, yep, it's normal. Well, unfortunately, it's not, because that's going to be the last actual test that's going to be affected through hypothyroidism. So we look at the whole panel, and we look at vitamin D, we look at B12, and we look at the hormones. So we get a whole game plan of what's kind of going on the inside as to why they're experiencing symptoms. And then the goal is to, you know, eradicate those symptoms, and we can do that. Through hormone therapy replacement, through vitamin replacement. Patients actually come in at 6 weeks for females. We look at drawing their labs, and we go over their symptoms. And the goal is to get all symptoms resolved. And oftentimes we do get that at 6 weeks, but we don't always know what the metabolism is going to be. So some patients need a little bit more. So we consider that just a little tweak in their dosage, and then they're smooth sailing for a year as far as repeating labs. And then males come in at 4 weeks for their repeat of labs, and we again ask them their symptoms, make sure that their symptoms have all cleared, and we go from there. As far as, you know, replacing vitamins, we carry a very reputable vitamin replacement through BioT and through Nutridyne. So there's going to be no fillers in those vitamins. It's a vegetable capsule, so everybody's kind of all into the whole organic, natural, don't want fillers in them. And as a provider, I want my patients' levels to actually respond. So a lot of patients will be like, oh, I picked up D3, you know, over at Whole Foods, and their level still isn't anywhere where we want it to be. So there's just a lot into it and a lot of tweaking as far as improving their health, optimizing their health. Oftentimes people think that hormone replacement therapy is just to increase libido, you know, and it isn't. It has a lot of other factors in that.
Right, and it helps people to get, you know, those people that have a hard time getting started. So you start feeling better on the inside. It's easier to eat better. It's easier to exercise. You have that energy. You have the want to get up and get going, and your whole life changes.
Yeah.
It's optimal wellness is what it is.
Awesome. I
Yeah.
love that. And we've seen so many patients that have just absolutely, they've even told us and come in and told you guys how just their life has changed. And they just keep coming back because they know you guys know the right path, and they're not going to go to their regular primary care physician. Not to knock those people.
No.
There's times in life where you do have to have prescription medication,
Right.
but it's not a Band-Aid.
It
You know,
is.
to the real problem. So for those that don't know exactly what BioT is, can you kind of talk a little bit about more about what BioT is, or hormone replacement therapy, and then what the procedure is? Because I know whenever I first started here a long time ago, I didn't know what the procedure was, and so I've sat in a couple times on it now, and so just kind of speak to that and how that process goes.
Absolutely. So BioT is actually a company that makes hormone pellets, which are basically made from the Mexican wild yam. So there's no synthetic hormones in the actual pellets. They're about the size of a grain of rice. So once we have the patient's labs and stuff, we will actually dose them, male, female, off of what their hormone levels are.
And weight.
And weight. And so they're, like I said, they're about the size of a grain of rice. We actually place them in the subcutaneous tissue in the area where you typically get a shot in your bottom. And so we numb that, make a very, very small incision, place those pellets under the skin there, and they dissolve over time. So They will, as far as how often will you need this therapy, women are every 3 to 4 months based on activity, cardiac output. Men are about every 4 to 6 months. Men get a little longer out of their pellets because we do put more testosterone in men because women don't need as much testosterone as the men do.
Gotcha.
So we're going to replace estrogen if they are already postmenopausal, or whether it be naturally or surgically through hysterectomies, and then we will replace testosterone in women as well as progesterone.
And it's about bringing them to the level that their bodies should be producing at that age. It's not bringing them above. It's not giving them heavy doses, the doses that people worry about with the raging and stuff like that. That's not what it's about. It's about what your body would be making
Yeah.
at an optimal level. So
Love
it's
that.
normal. It's normal levels.
Now, some might be cautious to have like an incision in their
Right.
buttocks. So, I mean, I guess what are the risk factors, if any?
The bruising would be or infection would be your only risk factors. We alternate right hip, left hip every time we do the insertion. It heals really well, so you're not going to look like a battleground with all these little incisions all
Oh,
over your
good, okay.
bottom. It heals very well. Steri-stripped closed, and a big dressing is put on it. So, and it just dissolves over the 3 to 4 months for females, and males are every 4 to 6 months. So
Now, I will say, what are leading up to your insertion? What are things to avoid, even like alcohol use and?
we recommend avoiding NSAIDs, alcohol prior to the insertion because it will increase your bleeding. But, again, we have patients who still continue, of course, doing things like that, which is fine too. We just may have to hold some manual pressure.
Oh, okay.
So,
So, and then as far as long-term risks, I mean, are there any, if you do continue to get this every, 5, 6 months or whenever it, they run out? I mean, is there a risk to just keep getting it done, or is it just all safe all the time? Have you guys seen anything?
there is no risk. I mean, it's actually been around, pellet therapy's been around for 70 years. It, of course, started in Europe where everything else starts
Right.
as far as medications because they all want to be healthier over there. And then slowly it gets to the U.S. Our oldest patient, I think, is 89 years old. So that's what keeps her mobile, keeps her playing with her grandchildren, great-grandchildren. She just doesn't need it as often, so we see her about twice a year. So once your hormones in females are done, they're done producing. So it's lifelong therapy. It's just how often will you need it?
Yeah, and that's important to say too, lifelong, because it's not something that's like a one and done. You can't just come in one time,
No.
expect it to change your life, and then never come back again. And then also speaking of the vitamins, so if you are doing hormone replacement therapy, what if someone asks, if I'm doing this, why do I need the vitamins on top of that? Why is that important?
Vitamins are essential for your body, especially during the times we're in right now with COVID. There's studies out there with vitamin D3, large doses, because vitamin D is your prevention in viral illnesses. FDA keeps everybody's vitamin D around 30. In wellness, we keep everybody 60 to 80 because that's what's going to actually prevent you catching the flu, catching COVID. That's what keeps you healthy. We all use sunscreen, so we're all blocking the sun.
Right.
And so, unfortunately, we all have low vitamin D.
Right.
So it's
Which we're seeing in
important.
children too now, there's tons of children that are low on vitamin D.
With all the bone fractures, I mean,
Right.
it's our American society, our
Right.
diet, it's
Yeah.
how we live.
Yeah, absolutely. Speaking of COVID, we actually do an antibody test, right? Are we still
Right.
doing that?
Yeah, we
so
are.
can you tell everybody kind of about what that entails? And so it's not a test for actual COVID.
Right.
like to
It's not
see-
a positive, negative
Okay.
screening, the nasal pharyngeal swab. It's an actual blood draw. And when you would just come in, you don't even need a consultation for that. Just book a nurse visit. We draw your blood. We send it off to our laboratory, which is CPL. It's the FDA approved antibody testing on an Abbott machine. So a lot of patients are like, well, because there's a lot of tests out there, finger poke. So
Yeah.
it is FDA's
Legit.
approved antibody testing, and it'll come back negative or positive. So whether you've had the antibodies and been a past infection.
Okay. So that tells you if you've had it in the
Correct.
past. Yeah. Okay. So, and then also let's talk about a little bit of our other wellness services that we offer, maybe like the IV therapy and then our vitamin cocktail injections and all
Yes.
of those, kind of more broad sense of what all we offer.
So some patients can come in once a week is what we recommend as far as vitamin shots. We can customize it with antioxidants. We have your B vitamins. We have some that are for anxiety. Biotin. We have D3 as actual injections. So for those patients who don't want to take pills or they're just not very compliant, they can come in every 7 days and actually customize their shot based upon their needs. We can also add those to an IV. So
That was going to be my next question.
Yeah.
I think we can, right?
we can
Yeah.
add that to an IV, and then they get the extra hydration. So those can be done. We recommend monthly if they're getting the actual shots, or
IV.
every 2 weeks they can come in and get an actual IV.
Nice. And I read something a long time ago that said with the Myers cocktail, right, is the IV that we do, and we can customize. But whenever you're taking a vitamin just orally, it only absorbs, 20%?
20 to
You only get like a
30%.
20% absorption. So whereas doing the IV, that's the benefit of doing the IV, it just completely goes right into your bloodstream. And
Correct.
then you get all of those benefits.
You absorb every bit of it, and whatever excess your body doesn't need, you excrete, through your urine.
That's awesome.
So-
Is that pretty popular? Do you guys have quite a few people that come in
We
and do
do.
that?
We do.
I know you've been doing so much BioT. I didn't know if there was time for anything else.
Right. No, we do. We do. And
That's awesome.
And as far as, is everybody a candidate for BioT? You do have to be 26 of age or older to start BioT therapy. And that is because we have, in men, it will decrease sperm count. So if you're still looking at wanting to have children, we're not going to really start you on something like that if you're younger than 26. But there's other options. We can do, shots. We can do orals. We can do supplements to boost your actual production. It's all going to be bioidentical. So we're not going to do, synthetic hormones that do predispose people to, breast cancer, uterine cancer, prostate cancer. So we can, function off of the actual natural prevention. Not to say that we won't prescribe synthetic. I mean, sometimes patients can't afford,
Yes.
the natural therapy. Or they want to utilize insurance. And unfortunately, insurance does not cover actual compounded medication. We hope in years to come that we'll eventually get it, on board. I think they're realizing through COVID that there is a lot of preventative things that they could have been doing to reduce the risk of catching COVID and the comorbidities that go with, I think it's 80% of the population who tested positive for COVID had
comorbidity.
underlying comorbididities,
Wow.
high blood pressure, type 2 diabetic. So patients come to us and they want to be healthy. Not to say that they don't already have high blood pressure or they don't already have type 2 diabetic. We can actually almost every time get them off those medications by living healthier.
That's awesome.
Yeah,
So-
and then we also treat weight loss.
Right.
Or- Yeah.
That is a
quite
good one.
often, actually.
So some patients will come to us, with that complaint of weight gain or COVID weight gain because they were all quarantined at home.
Right.
And all they did was
COVID 40.
Their
eat
feelings.
breakfast, lunch, and dinner.
Right.
So they didn't have anything else to do. So we're seeing, an increase as a result of that too.
Awesome. And that's what I was going to say too, was have you seen an increase in just your wellness consults in general because of COVID? Since then, I think it's kind of alerted everyone
Yes.
that they need to be, they need to optimize their hormones and make sure
Absolutely.
that they are living an optimal life and staying healthy. It just helps fight everything off for sure. And
Absolutely.
you mentioned cost and how it's not, unfortunately, covered by insurance, but we do take a flex spending
We
account.
do. We take flex spending and we take health savings account. So, that's, you can utilize that to pay for your consultation, to pay for your labs, to pay for your nutraceuticals, to pay for your insertions.
Right.
And, with fall coming up, we have open enrollment with your employers. So if you don't have that, it would be wise, just go ahead and, sign up for it so that you can utilize that to pay for those types of therapy. And if they do, bulk about, because you have to send in your invoices and stuff, and they'll be like, oh, well, what's BioT? So we have insurance letters that we can provide saying that it is a letter of necessity for patients, male, females, and we've been doing that for years, and they don't complain any further after they receive that letter. So
Nice. Well, and again, with the cost, I wonder if people do come in to get the wellness consult and then say you do recommend BioT and then they see the cost and they're like, well, I can't do that right now. There's obviously we've talked about all of
Yes.
our other wellness services. That's not just all we offer. We can help them in different ways.
absolutely.
And get them there.
And some patients don't want to just jump off and go straight to BioT. So
Right.
we will look at through supplements, and it does help improve their symptoms. Again, you've got that risk of 30% absorption because of their GI, but they do see some improvement in symptoms, and they're like, oh no, I want to get even better. So then they're on board.
Yeah, so they're sold
Right.
for sure.
Right.
I think I might be the only one on staff that's never had BioT. I
think
don't
so.
know what I'm waiting on
Absolutely.
because I think everyone else here has had it, and I've heard nothing but great things. I've worked for Emerge since 2014. Never once have I heard a complaint from
No.
any client or patient or anything having any weird side effects or anything like that. So that just is a huge testament, I think. And then also we take care credit too, so
Right.
they can, that can help also with the cost because you can make payments and they offer
Zero.
sometimes 0%, financing. So actually, if you're listening to this podcast or watching, then we would love to offer you guys $50 off your first new patient wellness consult with Amy and Shauna. Just come in and just have an open conversation with them. They just want to get to know you and hear about what your symptoms are and what you're struggling with. And then let's see if we can get you on a program that's going to change your life. So $50 off that first
Absolutely.
new patient wellness consult is really going to be helpful. And you can book that online. You can go to emergetulsa.com. If you click on locations, it'll take you to, we're actually in the 91st and Sheridan location. We are going to be offering BioT at our Midtown location, but we're not set up to do that just yet. So you can see, but Amy and Shauna are right here at South Tulsa. So you can book with them online, or you can call us at 918-392-8606. You can actually call or text, and we would be happy to get you scheduled then. So we look forward to seeing you. Thank you so much for listening to this podcast, and leave us a comment below if you have any questions. We would love to talk to you and meet you and get to know you. So we hope to see you soon.